A new set of guidelines on pain management during IUD insertion were released with a warning to doctors not to underestimate patient pain. 6 News reporter Sydney Walker spoke with a local expert in women's health about why it took so long to add these guidelines. Sydney?
Some doctors tell patients that an IUD insertion will feel like lots of pressure or just generally uncomfortable. Certified nurse midwife and co-owner of the Starting Place Brooke Fox said patients have told her that it feels like contractions during labor.
A lot more than just pressure.
New guidelines from the American College of Obstetricians and Gynecologists are telling doctors to take possible IUD pain seriously.
We have been told, this will be uncomfortable or you might experience discomfort. And we have been told discomfort is not necessarily painful, but maybe it is painful. Maybe we should be paying attention to that.
Certified nurse midwife Brooke Fox agrees.
If that procedure feels painful and we are told to just continue through, then that can become a very traumatic experience and have lifelong effects.
This update to the guidelines comes after a surge of complaints from patients on social media, especially TikTok. A 2023 study found that of the top 100 TikTok videos with the hashtag IUD, 96.8% of the videos about patient experience were highlighting the pain.
I have a lot of patients who describe it as sharp or extremely strong cramps, or even similar to contractions during childbirth.
The national organization is recommending various treatments like anesthetic cream or a local anesthetic, which Fox says can be very cost-effective and efficient. As to why the guidelines are just now being added, she cites a significant lack of research in women's health.
Unfortunately, our research for women's health and OB care is severely lacking. I think that we oftentimes view our country as being ahead of the curve, but reality is America has some pretty bad outcomes whenever it comes to OB and women's health care.
She encourages those undergoing procedures to speak up for themselves.
I would encourage you and remind you, you are your best advocate. You are the one who knows your body better than anybody else, and you can remind your provider in a very kind, gentle, and respectful way what the newest guidelines are.
Fox says that those going into a procedure should read over the new guidelines so they can understand their options and proceed in a way that works best for them.
Sydney, thank you so much for all that new information.